girls aged 10 to 14 get pregnant in the Philippines. The incidence of teenage pregnancy is on the rise among girls aged 10 to 14 in the Philippines, according to the Commission on Population and Development, or POPCOM. A 63% increase in the number of births delivered by the said age group was observed, comparing data from 2011 and 2018. Some 2,250 babies were born to mothers with such a young age in 2018, the POPCOM said. Why is teenage pregnancy a problem? Teen pregnancies can carry extra health risk to both the mother and the baby. Often teens don't get prenatal care, which can lead to problems later on. They have a higher risk for pregnancy-related high blood pressure and its complications. Risk for the baby includes premature birth and low birth weight. Why is pregnancy not good for teens? Teens often don't get prenatal care. One of the many reasons pregnant teens and their babies are at higher risk of health problems than older pregnant women. Teens younger than the age 15 are especially vulnerable to anemia or low blood iron and pregnancy-related high blood pressure. Where does teenage pregnancy happen? Nowadays, majority of teenage pregnancies occur in low and middle-income countries characterized by poor healthcare services. Therefore, complications during pregnancy like birth and postpartum phase are the second cause of death among girls aging between 15 and 19 years old worldwide. What are the effects of teenage pregnancy? The children of teen mothers are more likely to be born prematurely with a low birth weight, predisposing them to many other lifelong conditions. Children of teen mothers are at higher risk of intellectual, language, and social-emotional delays. Who is most at risk of teenage pregnancy? Teens at a higher risk of becoming pregnant are being the victim of sexual abuse, drug and alcohol use, having sex at a young age, lack of goals for the future. When did teenage pregnancy become an issue? During the decades between 1955 and 1965, corresponding to the baby boom era, women of all ages began to produce more children. The rise of fertility among teens both led to the resulted from a wave of early marriage that began in the post-war period. POPCOM explained that individual and institutional factors are behind the differing trends among the two age group of adolescents. Among the individual factors were early onset of menstruation, lack of education, and exposure to risky behaviors on the internet and in their circle of friends. Institutional factors include information, dissemination, and provision of access to family planning service for the younger population. In my opinion, girls who become pregnant as a teenager will face increased medical risks, and if the pregnancy is taken to term, there are also increased medical risks for their babies. We also know that teen moms and their children can suffer from poorer life outcomes.